We're going to talk now with Dr. Jamie Taweel with us again on the Oakland County Megacast about that and other related issues. Dr. Taweel, thank you for being with us today.
Oh, thanks for having me as always. How are we doing?
Doing all right. How are you doing? How's your team at the practice?
Keeping busy. We're really keeping busy.
So as I mentioned in the introduction to your interview, we saw a story today about that reported that coronavirus COVID-19 lab facilities are experiencing delays as more people are getting tested, and more of these samples are coming into them, and that may make results for more expedient tests that are even within a day, and even those that are a little bit longer for results that are within a week, a little more delay, which can cause some issues for those that need immediacy in knowing if they are COVID-19 positive or COVID-19 negative, because in many cases time is of the essence in treating this virus. How critical is it that we continue to get people that need the tests now or as soon as possible to get those results back, to keep them in the front of the line getting the results?
Very critical. I believe, my opinion is that anyone that needs to get testing done should hopefully get the results as soon as possible, because you have to wait until you are able to get a negative test before you're able to go and, interact with other people. There's definitely going to be priority. There are going to be people that are ill in the hospital that are going to need to get their results first. There are people that are required to have surgeries that we need to have results on. People that are entering extended care facilities or subacute rehabilitation, nursing homes, so to speak, to make sure that they're not really putting at-risk populations higher up, as well as essential workers, essential healthcare professionals, people that need to interact with other people for a living to try and help them out. You're going to want to get those results as soon as possible. So, any delay in results are always going to be a bit of an issue. It's going to grind things to a halt and also potentially put people at risk.
We've talked multiple times about the COVID-19 test versus the antibody test, which one's more effective, which one's more accurate. But and as we're experiencing these delays with the COVID-19 tests coming back, and it's causing these delays with such an influx at these labs, are there certain tests that should be for people that are in more serious situations, and then those that are just out of curiosity getting a test, should they maybe either delay getting a COVID-19 test or just get the antibody test, which maybe isn't as accurate but can give them a similar look into their story?
So the antibody test is a great test to show if there's been exposure. It does have a little bit more of a higher accuracy rate, but it's not going to tell us anything rather immediate. And there's still some concern whether or not, having positive antibodies is going to be something that's going to keep, essentially make you immune. So the validity of the antibody test certainly has its benefits. It can also show exposures. It can kind of be used to help with contact tracing where people picked up exposures, et cetera. The nasopharyngeal swabs and things to that effect are going to be a little bit more important because you want to know whether or not you're currently infected. So I think that it's definitely important. And then I think the best way to do this is to, again, go by symptoms. Have you been exposed, or do you have symptoms of COVID-19? And if that's the case, then you should get put to the front of the line versus the typical, hey, I'm just wondering if I have it. I'm alive and doing well, but I don't, I'm just curious. That might grind things a little bit more to a halt, if that makes any sense.
So a federal judge ruled this week that all the students at the Detroit Public School District in their summer school program had to be tested for COVID-19 prior to continuing the program. I think it was like 650 students. Yes. Do you think all students and teachers and staff should be tested before being allowed back into a classroom?
Personally, I think everyone should be tested, period. But, obviously we're limited to resources. We're limited by how much we're able to test. I think it can be, again, as a physician, my personal opinion is I do think people should be tested before you're going to put them in a room or a potentially dangerous situation. I think it's necessary. If you have anyone that's going into, for example, I often use outpatient surgical services as the critical example, but anyone that's getting an outpatient or a non-emergent surgery or an elective surgery is going to get tested, because if you're positive, you can put everyone at risk, and that ends up grinding everything to a halt. So I do believe that everyone should get tested because it's going to be important. Again, do we have the resources to do that? That remains a different story, and that's a little bit outside of kind of my thought process, so to speak.
So on that note, then, Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, with us on the MegaCast. If that's the case, and as we're returning kids to school, of course, they're going to be required. There's going to be mask requirements in these schools for the students and for the faculty. There's some lighter restrictions or regulations on mask wearing for some of the younger students. So would you say in that case that the younger students are less necessarily in need of testing or in need of mask wearing than the older students who are more independent, more out and about in that case? Or does it really ultimately still come back to a case-by-case basis? How are they interacting in regular life?
I think it's more case by case. If I understand your question correctly, is it just because the younger people are not required to wear a mask, are they less at risk for having and transmitting? Am I hearing that correctly?
Yeah, that's essentially.
I think also there's limitations to it. Younger, children that are they're gonna touch their face, they're gonna pull the mask, they're not gonna be as compliant. That might be a little bit more of a reason for them to not require the mask. If there's data that suggests that they are less likely, that's specific. I certainly haven't seen it. It does not mean it doesn't exist. But I do think that they should also still be tested because, again, infants do have a greater propensity to spread these things, specifically because they're being handled by adults. They're being passed around by adults. They're interacting more. They are less likely to practice social distancing. They can't, technically. They are less likely to, abstain from touching their face. They cough, they sneeze. They are germ factories, for lack of a better word.
Oh, yeah.
But so if you can't get them to commit to a mask, I think the testing probably wouldn't be a bad idea, just to ensure that they're not at least you're not putting someone who has, for lack of a better word, an unknown disregard for the norms that you would try to adopt in order to prevent spread. I think you should try and do the best that you can, and testing, in my opinion, I think is a better idea.
Dr. Taweel, anything else that's important for us to know today, or anything else you'd like to touch on before we let you go?
Well, same as always. Keep safe. You guys are doing a great job. I love the fact that you're spreading the word, and keep wearing the mask, keep practicing social distancing as best as you can. And if there's any concerns, obviously call your doctor. Do not hesitate to go to the emergency room if you feel you have a medical emergency. They are doing a great job at trying to separate things as best as possible. So,
Well, we appreciate having you on with us again today, Dr. Taweel.
thank you so much.